Welcome, 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 everyone. Hello out there. Welcome, welcome, welcome to Health is Wellness Week. How y'all doing? Welcome, everyone. Let some more people come on in here. Hello, everyone. Let us know where you are joining us from. Hi, everybody. Hello, Stanley.
Good afternoon, Nicole. How are you today?
Oh, I'm doing very well. Very well, thank you, sir. In sunny Las Vegas.
It is beautiful out here, and we want to welcome everyone to Health is Wellness Week, presented by Minorities for Medical Marijuana. Health is Wellness Week was started last year by Minorities for Medical Marijuana. This project was led by Nicole and myself, and we wanted to really be intentional on creating some quality content surrounding some of the work that we do here at Minorities for Medical Marijuana, with a key emphasis on the medical. So today's episode is going to be featuring sickle cell. We're going to have a three-part series this week. Today, we're going to be focusing on sickle cell, the disease process, but also talking to some patients who currently suffer from sickle cell. On Wednesday, join us for a discussion regarding chronic pain. We're going to hear from a licensed physician as well as a chronic pain patient, and we're going to hear more about how medical cannabis has helped them and what could it potentially do for you. And we're going to wrap up on Friday with an amazing show with some very strong leaders and speakers. We're going to have Nicole on here with us again. It's going to be Dr. Felicia Dawson and Ms. Sheena Robertson from Cannabis Noir for Friday's discussion surrounding cannabis and pregnancy. And without further ado, I'll let my host introduce herself and I'll introduce myself.
Oh, thank you so much, Stanley. So my name is Nicole Buffong. I am the Western Regional Director for Minorities for Medical Marijuana. I also serve as the Health is Wellness host for the monthly program. We host every month, the fourth Saturday of every month. On our social media platforms. You can find us right here where you're joining us live today, usually on our Facebook page, our YouTube channel, and our LinkedIn channel page as well. And I also serve as a national brand ambassador for Black Cannabis, one of our social equity brands. And so I'm grateful to be here today talking about sickle cell. We know we have some close family members, right, in our M4MM family that have sickle cell. We know that our founder, Ms. McCarthy, is passionate about this subject because it affects one of her close loved ones. And we'll learn more about that today and hear from him today. And so I'm excited that we get to talk about sickle cell today, Stanley. And I'm grateful. You introduce yourself, please, and let us know who you are. Let the audience know who you are if they don't already. But I know that you're going to go into what sickle cell is for those people who don't know. Those of you who might not have a family member that suffers from it, exactly what it is, and what are the side effects of having this type of diagnosis. So, go ahead, Mr. Atkins, please introduce yourself. You're on mute. There we go.
Welcome, everyone. My name is Stanley Atkins II. Many of you know me as the Canamedic, retired firefighter paramedic, and now cannabis healthcare advocate and educator. I spent a lot of time in emergency medicine. I transitioned into the medical cannabis sector when I realized there was a significant lack of fluid education between caregivers, clinicians, and the patients that needed the information the most. And that's where I came in, became the Canamedic. I am the National Director of Hemp Farming and Technology with Minorities for Medical Marijuana. And we're going to look forward to a great show today. You're going to learn, so be sure to click like, subscribe, and don't be afraid to share this video because you never know who it may help that watches your timeline.
And so tell us, that's right. Thank you, Stanley. Tell us a little bit about what sickle cell is for those people who don't know. What is this particular disease?
Yes, so when in regards to sickle cell, it is a blood disease and blood disorder that affects so many patients in America. Many of these patients are minorities and their demographics are minorities. We found out that many of the patients actually are sub-Saharan African in descent or Central South American by demographic population consensus. And what is sickle cell? What does it do? What does it do to patients? What are they going through? So I'm going to give you some brief numbers in regards to sickle cell and what is it. Did you know that in the United States, the exact number of people living with sickle cell disorder is unknown? Working with partners, the CDC projects that more people will be learning about sickle cell disease in the coming years. Here's some numbers that you may not know, but sickle cell affects approximately 100,000 Americans. Yes, 100,000 people. Sickle cell disorder occurs among 1 in about every 365 Black or African American births, and it also occurs in about 1 in about 16,300 Hispanic births. About 1 in 13 Black or African American babies are born with the sickle cell trait. The sickle cell trait is not the same as the disease, but the sickle cell trait patients do have the capability to develop disease, especially when they're having children. But why is this important? Why are these numbers so important to us? And why should they be important to you? Because of the long-term damage that's done to the body and what the patients go through. Sickle cell related deaths among Black and African American children are African American children younger than 4 years of age fell from 42% from 1999 to 2022. The drop coincided with the introduction of many different practices, from invasive pneumococcal diseases to vaccines. One thing that we do know is that sickle cell is painful. When a patient has sickle cell, your normal blood platelets are shaped similar to this rock. They're rounded. So when they're rounded, they pass seamlessly through your blood vessels, your arteries, your veins. You don't even notice, you don't never feel your blood moving. The problem with a sickle is that these are not rounded. They have more of a jagged edge, these blood platelets, and more like a crescent moon. And what happens is when those blood platelets travel through your blood system and your bloodstream, it is very painful. So imagine drinking glass through a straw. That is what it may feel like to many of these patients. And when these patients have a severe episode or what's known as a crisis, it is an inflammatory response that often requires hospitalization and severe medications for pain management.
Wow, Stanley, thank you so much for kind of giving us an overview of what sickle cell is. We know that it is painful for those patients that experience or are going through crisis, from what I've been told and how painful it is. And so a lot of times they are given opioids. And we know, based on our society right now, that we are living in an opioid epidemic, right? It's a pandemic. It is something that affects all of us usually daily. We've still got hundreds of people dying from opioid overdoses daily in this country. More people now than dying from COVID at this point. And that has been ongoing. It hasn't stopped. It hasn't slowed down. And what we've seen is that in some states where cannabis is actually legal, where patients can actually use cannabis versus opioids being their only option, we see the reduction in those states, just with the same statistics that go along with veteran suicide, that also go along with chronic pain patients. That's something that we'll get into on Wednesday. And so sickle cell would be in a lot of those states, medical states, on the list for conditions that doctors can subscribe or doctors can recommend the use of cannabis for in a medical cannabis state. And so we see that list, we see that disease, sickle cell disease, continuing to be added to lists in different states that qualify as medical use. But a survey I recently found that was conducted back in 2008 included 55 adults with sickle cell disease and found that 42% of participants had used cannabis within the previous 2 years. The main reasons for using cannabis were to reduce pain, relieve anxiety, and to help with sleep or mood. And so the authors concluded that this survey results warranted more research on how cannabis is used for pain. And so I'm grateful that we have two patients here today that are really patient advocates. They themselves have been diagnosed with sickle cell. And so I'm really excited to talk to them about how they've been managing the disease, how they use cannabis. And so I'd love to bring in our guests today. Our two guests, two gentlemen that I really admire. I'm looking forward to learning more about how they've been living as adults with the sickle cell. disease diagnosis. And that is our Brian McCarthy, our very own Brian McCarthy. And as well as our new to our M4MN family, or new to me. I'm so grateful to have you on today with us, Broderick Randall the second, who's going to be telling us a little bit more about himself. So I would like to start with Broderick, since he's new to our community and to our session. Let's start with you, Broderick. Can you tell us a little bit about yourself and who you are?
Yeah, good evening, everyone. My name is Broderick Randall II. I'm working business development and outreach and Bennett Leaves. I'm also, first and foremost, I'm a sickle cell warrior, a cannabis patient based out of Ohio. Born and raised in Toledo, but currently residing in Columbus. And uh, the reason why I'm involved, and the reason why I'm an advocate for cannabis is because after discovering and in my later on in my life, after I was going to college, cannabis has provided a much better quality of life. As you said, my sister and I, we were born with sickle cell anemia, SS, which is like the full disease. It's a genetic blood condition, really painful. My mother and father had the trait. So, back then they weren't testing for it. I was born, 89. So it was like very scarce testing. I found out after that my sister was born that I actually had it. So it kind of took a little bit of time to for me to be actually diagnosed with sickle cell. But my mom said, I would just cry a lot, and they couldn't quite figure it out. They tried their best to like tender to me, but over time, after doing the research, they found out that we both had it, including they also found out, like I said, they both had the trait, which is very important and huge. Like as Stanley mentioned earlier, the Canada medic, he said, testing, or a lot of people aren't aware, and so testing for it is pretty huge, and people need to try their best to get tested early as soon as they can for it, or have their child tested for it. The sooner the better, the more you can approach it better, and um, handle it in a better sense that way. Um, so, and I also want to talk on what Nicole mentioned, about opioids, which is very, very important and huge, and a part of my life too. Growing up with sickle cell, one of the main treatments is, basically opioids or some form of pain medicine. And they have other like medicines that they could provide to you that may, help to, ease symptoms or help, prolong. But like I said, over time, I was able to discover that medical cannabis, provided a much better quality of life for me. And, the versus the effects that I was receiving from, opioids or just being admitted in the hospital and getting the medicine that they would give, it's way worse. You kind of be used to taking the pills they tell you to take to alleviate those symptoms and pains. But, you either wake up foggy or just, the next day depressed or just sad, just not the
A
same.
lot more side effects, right? Can you
Yeah.
tell us what state you were in when you started using cannabis? Were you in a legal state?
I
You
was,
want to
yeah,
share that?
yeah. Well, I mean, when I first started using it, it wasn't like medically legal just yet. I'll be
Okay,
honest.
right. What state were you in
Oh,
when
Ohio.
Ohio, right? Okay,
Yeah,
right. And
yeah.
so no, it was not legal yet, medical. It is now in Ohio.
Correct. Yeah, it's
Um,
legal now.
right. And so of course that meant that when you first started using it to help manage the pain, because would you say that would be the biggest symptom that you were using to manage it?
Yes, pain for
Right.
sure. I mean,
Pain.
that pain and quality of life. I mean, just overall, like I said, well, that pain overall can affect anyone's quality of life. So
Absolutely, absolutely. And that's what we hear a lot from sickle cell patients. And so I would like for our next guest to also introduce himself because I know he's a sickle cell patient, but he also deals with a lot of other patients within the organization. So welcome, Brian McCarthy. Please tell us a little bit about yourself and who you are and what you do.
Hello, everyone. Well, thank you for having me. I'm just happy to be here. My name is Brian Elliott McCarthy, and first and foremost, I am a sickle cell patient, and I'm happy to say so. Right now, I am the M4MM FAMU chapter president and also the national patient care coordinator for Minors with Medical Marijuana. And that's been going really well. But let me tell you a little bit about myself. So I was first diagnosed with sickle cell about 2 years old, so a little bit later into my adolescence. And really through my childhood and growing up young adult life, it's affected me very in a very tough way. And having growing up with it and not being able to do other things that kids will want to do, as in play sports or hang out with your friends or things like that, just because you have real medical conditions going on, it's hard growing up. And just being able to find this relief in cannabis is how I did. It's amazing, and I wouldn't trade it for the world. So I initially was introduced to cannabis about 2 years ago in the state of Florida, medically. And it was really just on a whim, just hearing about cannabis and hearing about the medical effects that it can give and saying, I'm taking all these pills these doctors I don't know will give me, so why don't I try to do something for myself? And initially started using it, feeling the pain subside substantially, immediately. And the number one thing with, especially people with sickle cell who I've talked to, opioids has been the number one go-to for our pain management. As Broderick was saying, it makes us feel like crap the next day, to be honest with you. So it's a relief that we have something that's able to kind of help treat us and treat our pain and our lingering pain that we live with on our everyday life, and to have something that we enjoy and also brightens the spectrum of meeting new people, getting introduced to new societies and new cultures just because of a plant. And who would ever thought that me myself would be sitting here today talking about this? So just marijuana has definitely affected my life in a very positive way, and I just want to touch as many people as possible and get into this plant.
Oh, thanks so much for the work that you do, Brian. It's so important. I have a quick question for both of you. If you can tell us what has been your biggest challenge with trying to find uh, first the right doctors. Like once you got diagnosed and then you started using cannabis, what has been the biggest challenge for you trying to explain to your doctors what you were using and why you were using it, or maybe it was getting access to the actual safe access to, the medicine that you needed. I know, Broderick, you said when you first started, you were living in a state that didn't provide access to that safe medicine. So what has been your biggest challenges over the last few years?
Definitely education and awareness. So, like you said, it wasn't legal at the time, and I was definitely keeping it a secret from my doctors and even my family. But the doctors, it couldn't be kept too secret because they test the urine, so I'm sure they seen high levels. But it was, they would also compliment like, "Yo, you look pretty well," for one of our sickle cell patients. And I'm like, all I can tell you is I try my best to, eat right, drink water, and I've used a lot of cannabis in different forms, and people got to be aware of that too, because it's not just smoking. There's you can eat it. There's topical lotions. So just education and awareness, and like trying to inform my family too, convince them it's the right way. The biggest challenge, though, like you said, is just finding doctors that align. I know a lot of patients, including my sister, that struggle with finding a doctor that'll actually accept it and then like allow you to use cannabis and then help to maybe wean you off your opioid uses or whatever. I wish more doctors were way more acceptable to that or open to that, or even there was more like a clinic for that, because it's ridiculous, this opioid use abuse out here. Um, you know, I hope that answers the question.
No, absolutely. Yeah, Brian, share with us some of your biggest challenges. You started with your cannabis use in an actual legal regulated medical market. So what were some of your challenges that were probably different than what Broderick had to face?
Yeah, so like my experience getting into cannabis was a little bit different than Broderick's. My experience actually happened, and I was introduced just because of honestly my mother, of her being the founder and CEO of Minorities for Medical Marijuana, and putting a plan in my face and making me notice about just being curious and having questions about it. And my first encounter with cannabis and getting access to it, I actually was at a local medical marijuana treatment center in Tallahassee, Florida, and going to see the doctor was a really good experience because in the past I've never spoken with a doctor about something that had to do with my medical history that wasn't going to be solved with opioids. So just initially finding that MMTC in Florida is what we call it, to be able to have that safe access to a physician to talk about this plant was amazing because it answered all the questions, it answered the stigma questions, and will I go to jail? That's everybody's number one question. No, you won't. How much can you have, and what can you have? And what Broderick was saying earlier about the different type of formulations they have for the topicals are amazing. Speaking for myself, but just cannabis has actually been a really easy transition into my life. Thankfully, my personal physician is actually really, really good, and they accept it and they don't have any problems with it. I'm open and candid with them and let them know everything I got going on, and I have a good support system for that. So I'm blessed and I'm thankful for it.
Thank you guys both for that information, and thank you for being fluid and being open and willing to share your story. A lot of times in the advocacy work and the educational work, we oftentimes lose sight of why we really start. In many cases, when you're dealing with legislators and lobbyists and MSOs and just money involved. And I'm really thankful that we have an opportunity to have two men on here that not only reflect the sentiment and how I feel about medical cannabis, but they're a direct representation of my community. And that leads me into my question for the both of you, and I'll start with you, Brian. As a sickle cell patient, you have probably spent countless hours in emergency rooms and treatment clinics in your young and developing life. So, with that, every patient's different. We, as healthcare providers, we know the general spectrum of symptoms, but each patient's symptoms and what they display is different during a crisis. So, just for you, briefly, what are some of your most severe symptoms in which you know that you're going to need treatment? What is that like for you when you're experiencing one of those sickle cell crises?
Okay, so for me, initially, a sickle cell crisis for me would happen abruptly and suddenly. It would be no warning or no cause. Sometimes there's different environmental causes that can happen from it. As in, for me myself personally, cold weather can trigger it sometimes, and also going if you go swimming in the pool and it's a little cold outside, that will also trigger it as well. But for me, the symptoms that I undergo the most is a lot of musculoskeletal pain. So that's just pain. You'll feel it kind of aching in your bones. You'll feel it when you walk. You'll feel it just laying there. And sometimes it makes you like you're incapacitated. You can't really do anything because you're in pain when you walk. So for that, cannabis has helped tremendously. I can't even talk enough about it. And then another symptom I would have is also just major pain. So I would go into a crisis mode and I'll have pain either in my extremities, so my arms, or sometimes my legs, and it would just be it wouldn't be a good feeling. It would be a lot of pain for a really long extended period of time, and yeah, it's not a fun experience, but cannabis has definitely been the number one problem solver to this more than anything I've ever been introduced to in my life.
And thank you for just, again, being willing to share your story. Ladies and gentlemen, please don't be afraid to speak up because you never know who may come back and watch one of these videos, and your story or your testimony may be what helps them to reach out to their doctor, to ask their physician. And that leads me into you, Mr. Broderick. So when you have a sickle cell crisis or a flare-up or, an extreme case, what are some of your signs and symptoms that you deal with?
Similar, like as far as he said, musculoskeleton and just site specific relief. I use like sometimes I might have like shoulder pain or back pain. I've had my shoulder actually replaced already due to bursitis. So necrosis caused the death in the bone in that area. So that had to have that replaced. And so sometimes due to cold weather or even rain, sometimes it'll cause a flare up. And I've found using site specific like topicals to help provide relief. Actually, even taking ingestibles to help stay on top of the pain relief. And like I almost treat it like almost like a vitamin in a sense. Like I feel like cannabis helps. Like you got to figure out your tolerance and your dosage, but like you also have to continue at it and use it as often as you seek it for that relief. And I've noticed that for me, that's honestly every day in some form or another, that it helps keep keep my pain at bay, and it helps in with mood relief, appetite, just all forms of ways to help alleviate and battle the chronic illness that we're genetically diagnosed with. I've used vape carts or flowers for quick pain relief if I felt like I want to try to quickly get some pain relief instantly, more rather than the edibles or sometimes the tinctures are a little bit faster too than edibles, but edibles take a little bit longer. But if you're doing a layered effect, you can use the faster option first, and then let the edible kick in later.
Mm-hmm.
But I've tried to do multiple forms, and also discover which ways work for me and which ways don't, or which ways do I prefer or not. I know it's best to try to keep a journal or keep notes. In this industry, even in the regular health industry, I feel like you're your own doctor. You know what you're going through and what you're feeling, what works, what doesn't. But the best thing you can do is try to communicate that to your physician, and go back and forth to help figure out that right regimen for you.
And Brian, can you tell us a little bit about your work with patients in the Safe Access program? I know with M4MM Safe Access, you work with patients. Would you say that enough patients even know about cannabis as an option if they're dealing with the sickle cell as a diagnosis? And then what exactly do you do? What is Safe Access? What is that?
Yeah, so as I said earlier when I first came on, I'm the National Patient Care Coordinator for our Safe Access Clinics. So our Safe Access Clinics are really what they mean and what they say. So we want to give safe access to people who want access to medical marijuana. So as me and my role that I've handled, we've been starting this for the last about half a year, almost a full year now, about doing these clinics and being able to travel to different cities and talk to different people about introducing them to cannabis, and them coming in with questions asking, hey, what do you guys have going on? We have a free medical marijuana clinic, medical marijuana card clinic going on. We have a physician on site to answer all your questions for you. And we just want to make it an open conversation. And that's what we really try to make it about. We don't try to make it about, hey, come get a card. Hey, come get a card. That's not what we're here for. We're here to give education. And the education we give is just so good, people just want to get a card afterwards. So that's just what we do as M4MM. And just being part of this and being able to reach and touch other people and see people that look like me talking to sickle cell patients. Recently, our last clinic was in St. Louis, Missouri, and I actually spoke with 2 sickle cell patients myself and talking to them and telling them myself and telling them my story and telling them how much it helps and telling them how Roderick was saying that pretty much you're your own doctor when it comes to sickle cell a lot of the times. You don't have the best physicians. We don't have the best care a lot of the times. We get the secondhand treatment. And you should treat your regularly medical visits like you would treat if you wanted to experience with cannabis. Get a journal and write down how the dosage makes you feel, what's too high for you, what's too little for you. And just these are some of the stories I share with people as doing these clinics over the last year. Just trying to get them aware and get them education for people that are inexperienced with the plant. And a lot of people are very, very curious about it, but the stigma around the plant is just so negative, especially when it comes to the minority community. It makes people standoffish, and that's what we're here for. We're trying to bring the education to you. So that is really what the Safe Access Clinics are about. It's education about the plant and also access to it as well.
Thank you for that.
And that leads me into my next question. If you look at the bottom of the screen, ladies and gentlemen, you see tetragramapp.com. Be sure to download the Tetragram app. It is an amazing platform that helps patients track what they're using, when they're using it, why they're using it, and the effects the desired effects versus the effects that they got. And this is how we learn to create those treatment profiles by saving the data in order to help other patients. Now, Broderick, I know that you've been doing work on a day-to-day basis regarding education and patients. So it's a 2-part question for you. One, tell us a little about your experience on the day-to-day basis interacting with others such as yourself, educating those who may not be as educated, and what can we do as an organization, as advocates, as parents to help educate and bring more awareness for sickle cell patients like yourself and Brian?
pardon me. On a day-to-day basis, I work at Bentley's. We're a standalone processor. So we're based out of Columbus, Ohio. We make vape carts, topicals, edibles, lots of edible options, and just we're able to sell our products to the current 58 dispensaries in Ohio, and then there's also 73 coming on, and like I've been able to. I started as a bud tender, where I was able to actually help as the program began, and I was able to help educate a lot of the folks of Ohio to and introduce them to cannabis, or some of them that were already familiar, maybe introduce them to other forms. So that was pretty fun and interesting. And then I converted over to, like I said, Bentley's, being a processor or manufacturer. We make products and provide it to the patients. So being able to take my like passion and desire to help others over there, I'm able to now like travel to different dispensaries, and sometimes I'll do a vendor a pop-up day. It's called educational day, kind of come there and talk about the brand and what we provide and offer to the patients. Be able to help educate all of the bud tenders there, or the patients or people coming through. I like to call the patients. They're people more than patients, is there, but I just love to talk to everyone about cannabis, and maybe either help them learn something else, or just help them be more reassured too, to like respect that they use it, and not to be afraid of it, to help normalize it. Is as you said, we need more education and awareness for both cannabis and sickle cell. I'm not afraid to tell people why I use cannabis, to to help them realize that this is medical for me, and we all have some kind of use that cannabis could be medical for. I feel like with more research and more time, it'll be discovered. It's always been that way, and I just love going around, traveling all over Ohio, being able to interact with the different folks to hear what they have to say, or just think about cannabis, or even be willing to, like I said, learn. We offer facility tours too, so locally or just to anyone, if you ever want to come in and see how we make our medicines. So it's pretty cool being a part of that on the daily. Just being a part of a great team, being able to supply Ohio residents with fine quality medicine, whether it's in edible form or vape carts, like topicals, whatever we can offer, even baked good options. We got really good.
Okay. That is amazing.
Soon, Black Buddha.
And that is amazing, and I really appreciate you touching on the various options that you guys have. And I totally agree with you. The only way to do the work is to actually do the work. So when you have those opportunities to educate them educate a patient on a product, on a topical, as you stated, the edibles may take a little bit longer. So you can put the topical on for now, then consume the edible. So by the time the topical start wearing off, the edible can start to be peaking. So these are very important, and I definitely am grateful for fellow educators and community advocates like yourself.
And I did leave out one part. I'm sorry, not to interrupt, but to also help spread more awareness and education on sickle cell. I always, like I said, talk about it at any of my vendor days. But there's a book, Courage in Cannabis, that I have my story that I'm able to, and there's a doctor that is actually able to support myself and 20 others that talks about more on my story in depth, and how we sickle cell has been always. I mean, cannabis has always been a nice alternative, healthier way for cannabis and pain management, chronic pain management.
We love Dr. Bridget. She's so amazing. and I know that the name of the book, we had somebody from my live ask the question, what is the name of the book? The name of the book is called Courage in Cannabis. You can find it at courageincannabis.com. Thank you so much for that, Broderick. I have a question. I know that there's a program that we support here at M4MM called bethematch.org. So I wanted to make sure that Stanley talked about his experience with that. And what is Be the Match?
So, BeTheMatch.org is an organization that was referred to me by our founder and president and sickle cell warrior herself, fighting for patients across the world, Ms. McCarthy. It was when we had a discussion surrounding sickle cell, and I really learned more information about one of our lovely guests, Brian, and to hear about his story and to hear Roz be very transparent in sharing that information. So, BeTheMatch.org, we have to find more donors who are compatible for donations. So what you do is if you say, hey, I may not have the monetary means to, support a patient, or I can't go run a 5K, well, you can go to bethematch.org, request a testing kit. It takes about 10 days for mine to show up. It's going to be a testing kit that you open. It has pre-packaged another shipping container in there. It comes with simple instructions. It comes with a swab. You merely swab, insert, fill it out, send it back. They use these tests to identify potential matches for patients in need. I personally have a relative that was suffering from leukemia, and they did a similar test, found out that one of her siblings actually was a match for a bone marrow transplant. So if you say, hey, I'd love to help save a life, please go to bethematch.org, because you never know, you may be the match for someone you know or a complete stranger.
Yeah, thank you for that information, Stanley. And so, before we go, I want to make sure that everybody gets to talk about their different projects. We heard about Broderick's book. We want to make sure we're supporting that, Courage in Cannabis. You can find it at courageincannabis.com. And then, is there anything else coming up that you want to talk about? Maybe any safe access events that might be coming up you want to let folks know about, Brian? And what else? What is a good way for people to follow you or reach out to you? What kind of advice do you want to leave with other potential caretakers or potential patients that maybe have already just got diagnosed? What kind of advice you want to leave for them?
Yeah, so just starting off, we have 2 safe access clinics coming up. We have our first one is going to be in Philadelphia. That is going to be this upcoming Saturday, the Saturday the 24th of September, and that's going to be amazing. I'm going to be out there in person, meeting people, shaking hands, kissing babies, the whole shebang. But and then we'll have another one going on the following week. It's actually going to be in Ohio, in Broderick's hometown. So we'll have one in Ohio. That's going to be on September 30th, and that also is going to be a great event too for people who want to come out. And if you want more information about the event, you can go to M4MM United, and all information about our events will be there. So just about myself, really, guys, just to sum it all up, cannabis is not something that you should be afraid of or standoffish of. You should have the curiosity to ask these questions, and organizations like M4MM will give you the information that you want and give you information that you need to kind of make the decision for yourself. And as a sickle cell patient who has had a lot of success with cannabis, I would definitely recommend it. And I would be happy to answer any questions anybody has that you want to talk. If they want to know more of my story, the best way to reach me is actually through my email, which is brian@m4mmunited.org. And that is the best way to reach me. So if you have any questions, be my guest and please reach out.
Yeah, and Broderick, can you tell us that? Thank you so much, Brian. Broderick, can you tell us a little bit about what you might have coming up and what you want to leave the people? What advice you want to leave with our audience today?
Yeah, there's a Ohio Cannabis Expo coming up in Cleveland. I believe that's the day before Brian just mentioned their event. So it's October 1st and 2nd. There's like Ohio Cannabis Health Summit. That's pretty solid. I would also me and the Bentley's team will be down there. I would also like to, shout out and say, go support the Sickle Cell Alliance Foundation. I'm a board member of that, based out of Cincinnati, Ohio. Me and one of my best friends are working on a podcast, Ohio Cannabis Report. So if you want to go follow us on social media, on Twitter or Instagram. And as you can see with the pen right here on the wrong side, time well spent. Me and some of my other brothers too. It's a brotherhood. You put your time and effort towards anything you want in life, you can get it. Time is more valuable than money. So I'm trying to make sure all my moments of life, especially battling this condition, is time well spent and just enjoyable and appreciated. And cannabis has definitely made me be able to enjoy that and do that. So I thank you all for the opportunity, and thank y'all for supporting the cannabis the way it should be, and it's a medicine, and let's continue to get it respected and normalized.
And that happens with conversations like this. It happens with people that look like me and you, coming out of the cannabis closet, I like to call it, and making sure that people in our own communities, our own family members are aware of how we use cannabis. You're absolutely right, Broderick. Cannabis is medicine. Doesn't matter how you want to use it. If you want to go as an adult and use cannabis and then go on a hike or paint a picture, it's still affecting your endocannabinoid system. And in that way, it works as medicine. So thank you so much again for taking the time to spend with us today. I really appreciate you. Courage in Cannabis, folks. Get Broderick's book, and then you can learn more about how to support him. It's courageincannabis.com, right?
Correct.
That's right. And if you want to learn more about what Brian is doing with Safe Access, please visit our website at mmunited.org. We are going to have our Health is Wellness Week continue. This was the first day with our sickle cell awareness. Like Stanley mentioned at the beginning, on Wednesday, we will be having a conversation about chronic pain management. And we will be talking with Dr. Donna Balin, looking forward to meeting her and talking with her. And Miss Denise Butler, a patient that is dealing with chronic pain and using cannabis. And then on Friday, we'll be speaking with Dr. Felicia Dawson and Sheena Robertson of Cannabis Noir about pregnancy in cannabis. So thanks again, everyone, for joining us. Stanley, I'll let you wrap us all up here. Thanks again, Brian and Broderick, for joining us today. We really appreciate it.
Yeah. Thank y'all. I try to wear red for the Sickle Cell Warriors.
Oh, good.
And thank you, Nicole, as well. Ladies and gentlemen, we want to send a special thank you to our esteemed guests, Mr. Broderick, Mr. Brian, the B2B connection, and we're not talking business to business. This has been day one of 2022's Health is Wellness Week. Please stay tuned for more Minorities for Medical Marijuana programming. Stay tuned for our Health is Wellness, our Sow the Land Hemp program, our in-procurement program, our First Fridays with Ms. Roz McCarthy, because we have a variety of programming. Look out for our Veterans programming by Mr. Joseph Fernandez, and we're going to continue to remain intentional. Our goal in this is to bring education and awareness to the people who need it most, and with people like yourself and the team that surround us, together we can be more impactful. Again, my name is Stanley Atkins II, the Canamedic, signing off for the first day of Health is Wellness Week, presented to you by Minorities for Medical Marijuana. Be sure to click like, subscribe, and comment for more information.